For women who are not breastfeeding, noticing any discharge from the nipple can be very alarming. However, it is important to panic less. While nipple discharge can be very scary in some cases, it is usually either normal or due to minor conditions. Hello everyone, my name is Dr. Buchi, and here is to welcome you back to Dr. Buchi on Purpose channel, where we discuss all aspects of health issues, related topics, and academics. So stay tuned as I dispense this information. If you find today's information valuable, please do well to like, share, and subscribe to this channel. Lactation is the process by which the mammary gland produces milk. It is a natural process that typically occurs in women during the postpartum period to nourish their newborn. However, lactation can occur in women who are not pregnant, a condition known as galactorrhea. Let's explore the causes of nipple discharge. Discharge can either be milk or non-milk. Starting with milk discharge, it is common during pregnancy, during breastfeeding, for some milk to leak from the nipple. This can even happen up to a year after you finish breastfeeding. Occasionally, women who are neither pregnant nor breastfeeding can also experience milk discharge known as galactorrhea. Although it is not a disease, it can indicate an underlying issue.
This condition can affect women who have never had children, post-menopausal women, and even men. Milk production in the body is influenced by various hormones. These hormones are estrogen and progesterone, which prime the breast. Prolactin stimulates milk production, while oxytocin triggers milk release. High levels of prolactin, a hormone released from the pituitary gland, cause milk discharge. This condition, hyperprolactinemia, can be normal or indicative of a disease. Reasons for galactorrhea, which is the milk discharge from the breast, is in non-pregnant women. Number 1. Hormonal imbalance.
Elevated levels of prolactin, the hormone responsible for milk production, can cause lactation. This imbalance can be due to pituitary gland disorder. Example is prolactinoma, a benign pituitary tumor. Next is hypothyroidism, meaning underactive thyroid. Polycystic ovary syndrome is another one. Number 2. Wearing of tight bras and tight clothing around the chest area. Number 3, excessive breast stimulation, especially during intercourse through sucking. Excessive sucking of the nipple by your partner when making out or otherwise. Number 4, certain medications such as anti-epileptics, antacids, birth control pills, anti-anxiety drugs, and antidepressants, antipsychotics, antihypertensives, hormonal contraceptives, etc. Number 5, herbs and supplements. Some herbal supplements such as fenugreek and phenol can promote lactation. Number 6, tumors in the pituitary gland, specifically
pituitary microadenoma, which often respond well to medication. Number 7, chronic kidney disease. Number 8, chest injuries or surgery. Number 9, spinal cord injuries. Number 10, excessive stress or sleep. Number 11, dehydration. Number 12, sexual activities. Number 13, seizures, and even excessive exercise. Now let's discuss non-milk discharge, which can vary in color and texture and may be thick, thin, or sticky. It can come from one or both nipple and either leak on its own or appear only when the nipples are squeezed. The color of non-milk discharge can provide clues about its cause, but any discharge warrants a doctor's evaluation. White, cloudy, yellow, or pus-like discharge may indicate an infection. Green discharge could signal cysts. Brown, thick, cheese-like discharge might suggest blocked milk ducts, known as mammary duct ectasia. Clear or yellow-green discharge may be seen in fibrocystic breast disease. Clear discharge could indicate a benign papilloma or rarely breast cancer. Blood stain discharge raises concern about breast cancer. Besides discharge, be alert for symptoms like lumps, breast or nipple pain. Nipple inversion, dimpling, color changes, itching, scaling, skin rashes and size changes between breasts. Though nipple discharge often results from benign condition, any discharge, especially if blood or clear from one breast or occurring spontaneously and continuously without stimulation, should be evaluated by your doctor. If you notice any discharge from the breast, do not panic. It's likely a benign or treatable condition. Schedule an appointment with your doctor, have your medications reviewed, undergo recommended investigations such as blood tests like thyroid profile, serum prolactin, cytology of the discharge, ultrasound, mammogram, or biopsy if needed. If serum prolactin levels are high, an MRI of the brain may be required to check for the pituitary tumor. Panic should be far from your options. A systematic approach to the diagnosis and treatment will resolve this very issue.
Meanwhile, let's find out what to do about lactation when one is not pregnant. First of all, you have to consult your doctor. If you experience unexpected lactation,
it's important to consult a healthcare provider to determine the underlying cause of the problem. Number 2, medical evaluation. Your doctor may perform a physical exam, review your medical history, and conduct tests such as blood tests to measure hormone levels, especially prolactin and thyroid hormones. Image tests like an MRI to check for pituitary tumors. Number 3, medication review. Review all medications and supplements you're taking with your doctor to identify any of them or if any of them might be contributing to this condition. Treatments for galactorrhea. Number 1, addressing the underlying cause. Treatment focuses on addressing the root cause of the elevated prolactin levels. In the cases of pituitary tumors, medications like dopamine agonist, e.g., bromocriptine or cybergolin, can reduce prolactin production. Surgery may be needed in some cases. In hypothyroidism, thyroid hormone replacement therapy might normalize hormone levels. In the case of medications, switching to alternative medications that do not elevate prolactin may be necessary. Number 2, medication adjustment. In the aspect of medication adjustment, if a drug is causing galactorrhea, your doctor might adjust the dosage or switch you to a different medication. Number 3, lifestyle modification. In this case, reducing stress and avoiding excessive breast stimulation can help. Monitoring and follow-up. Regular follow-up with your healthcare provider is important to monitor your condition and adjust treatments as necessary. If galactorrhea persists or is associated with other symptoms like headaches or visual disturbances, then further evaluation may be required. In summary, while lactation in non-pregnant women can be concerning, it is often manageable with proper medical evaluation and treatment. If you got value from this information, please like, share, and subscribe as I look forward to seeing you pretty soon. Oh yes, if you watched through to this point, I would like you to indicate by typing hello, HELLO, at the comment section. Thank you for being part of today's video. I look forward to seeing you in our next section where we will be discussing losing baby fat and how to get back in shape after child's birth.
Dr. Bookie standing tall, believes in learning, giving all. With knowledge bright, we light the way to a world that's better every day. Learn and teach, grow and reach, empower minds and hearts will breach. Together we'll make a change, inspire the world to rearrange.